A new program, the Julia Oyer Fund, has just been established at Upstate Medical to improve addiction care.
And joining us now to talk more about it is Julia's mother, Mary Beth Dunewald, and Upstate Medical University professor Hesham Massoud. We appreciate both of you being here today. We have a lot to talk about.
Mary Beth, I think the first place we have to start was with Julia. Who was Julia, your daughter?
Julia was incredible. She was a beautiful and brilliant woman. She had a wicked sense of humor, but she also had a very sensitive side, and she felt a lot of compassion for people that had healthcare challenges and had difficulty navigating through the healthcare system. And I think that's really what inspired her to pursue a career in healthcare. So she had her master's in public health, and she was in the very early stages of starting what could have been a very promising career that unfortunately was cut short by alcohol use disorder.
Let's talk more about that. She passed away at the tender age of 29, and what a battle she had. Tell us how difficult that was for her.
It was very hard for her. I mean, there's a lot of stigma associated with addiction, and Julia felt a lot of blame and shame of me, of all people. How could I have let this happen? How could I have let it get so out of control? And I think that was a big barrier to her to wanting to seek treatment for the various medical issues that she was having, because she knew that the underlying cause was heavy alcohol use. Fortunately, when she did enter the healthcare system, many of her healthcare providers were just very good, and they met her with a lot of compassion and empathy, and all of them talked to her about the need for addiction treatment. But the conversation stopped short of also counseling her on the risks of withdrawal and the need for medically assisted withdrawal, because whether or not a patient wants to seek addiction treatment, they may need assistance with withdrawal, because what we didn't know at the time, neither she nor I, was that alcohol withdrawal could be deadly. So in the years after her death, and my husband and I and other family members have been working with the Upstate Foundation to create various funds that are really focused on changing the conversations around addiction that happen across the healthcare setting, not just in addiction treatment.
Yeah, right. Which is where we bring in Professor Massoud. How can this fund, this simulation lab, kind of help in cases like Julia's, like Mary Beth was talking about?
Yeah, I think it does two things. Well, so one, the fact that there is an explicit name around the fund and a patient story for this condition in and of itself creates an awareness. And so that value proposition, pardon me, in and of itself is its own tangential benefit. And then the fund is being utilized to teach essentially what is this really complicated example of the overlay of affective learning objectives with the cognitive stuff to keep in mind. So all of the things that are loaded with the counseling related to the withdrawal, pardon me, the alcohol or substance abuse, but also keeping in mind the particular context of the medical condition of that patient and how that can be exploited in the setting of a withdrawal. And so there's a lot of care that is beyond just recognition. There's the context of counseling and then the application of medical care. So.
Right, and as Mary Beth pointed out, it's the withdrawal that's often the most difficult part of the battle.
Yeah, and it requires its own conditions to be safe. So it's not just a matter of plug and play, and it's up to the patient to then have the resource and utilize it. It's also about creating the safe conditions so that withdrawal occurs, if it is going to occur, in a safe environment and is sort of a gentle landing, so to speak.
And that's what's missing?
Yes, I think, I know that there are a lot of great support services for withdrawal within addiction treatment facilities, but it's that barrier for somebody with addiction who feels that they're not ready for addiction treatment yet. So they hesitate to seek that out. And honestly, I mean, there's been so many advances in addiction treatment over the last just 10 years. And it's very patient-centered now. And I think there isn't a solid understanding with people with addiction about what can happen if they do seek addiction treatment. It's not a pass-fail paradigm. There's a lot of treatment modalities available for them.
Wrap it up with this, Mary Beth. Tell me what you think Julia would think about all this, having this named after her and trying to help so many people.
Well, even though she hated being the center of attention, she was passionate about making a difference in healthcare, and that's what these funds are doing, and I think she'd be very pleased about that.
And how can people help?
Well, contacting the Upstate Foundation if they'd like to make a donation. And if there are any healthcare providers that are out there that would like more information about Julia's story, I'd be happy to talk to them.
We thank you both for sharing this. I think it's a really important conversation, so we appreciate it very much. Thank you for being here.
Thank you for having us.
Download the WSYR Plus app on your TV to stream News Channel 9 for free. Just go to your smart TV, search WSYR Plus in the App Store, and download to start streaming today.